Today is July 27, 2020, 8 months after the first case of coronavirus disease. 653,789 deaths and more than 16 million cases of COVID-19 affects 213 countries and territories. Which country did well in managing the pandemic? Which failed? The best and worst response to the coronavirus in today's episode of the Naked Politics podcast. The very word pandemic conjures images of global disease and death. The 1918 Spanish flu, which did not originate from Spain but from America, is a jarring reminder that the pandemic can kill more than 50 million people and infect 200 million globally if public health measures are not put in place fast and seriously. Maybe some would argue that now is not the time to reflect on which countries handled the initial outbreak response better than others, because we don't know in which stage of the pandemic we are in, which could last for years. But this discussion is both an example for other countries to follow that is still battling the coronavirus and to gauge which countries have best positioned themselves for whatever comes next. This is John RG, podcasting from Los Angeles, joined by Jeff, podcasting from Dublin, and Emil, podcasting from Manila. Ivy Ganadillo is also joining us from K-pop land in Daegu, South Korea. Hi, everybody. All right, let's start. Maybe nobody alive have experienced this kind of global disruption, di ba? Or maybe kung may buhay man, they were toddlers at that time na hindi pa talaga naiintindihan kung anong nangyayari. But this was a kind of disruption that more than wars or more than natural calamities that the global community experienced. And somehow, this started, alam naman natin lahat, although let's not dwell on how the virus came into being, but the first epicenter of the virus is in China. It's in Wuhan. The first cases ng coronavirus disease was first identified coming from a market in Wuhan. So, initially, Ivy, siguro dahil ikaw yung China expert namin dito, maganda sigurong malaman natin what was the initial response of the Chinese government when there was a few cases pa lamang ng coronavirus. Ivy?
I think first it was known in the world about coronavirus something like January or February. But actually, as China study scholar, I've been following the news in China. And December pa lang, it's all over the news na, that there's some kind of virus spreading in China that is actually very communicable. Mabilis siya makahawa. But I've been warning some of my friends, like, don't go to China because there's a virus there. And like, everyone is actually ignoring it. I mean, one of the reasons, of course, is we know for a fact that China is actually controlling all the news that will be released in media. So again, December pa lang, these cases are actually spreading already in China, and then it actually been into public and known into the world around January before the Lunar New Year. The Lunar New Year, which is, I think it's January 23, where all the Chinese are actually going on different parts of China, going back home. It's like the New Year in the Philippines or the Christmas in the Philippines, where uwi sila sa kanilang mga hometown, and this was known during that time. But again, yeah, of course, like in the news have said, and everyone knows it started in a seafood market in Wuhan, China. So there are doctors who are diagnosing some patients that there's some kind of like pneumonia kind of disease that is spreading. So in China, laboratories have been studying about this kind of virus already. Very limited yung data na lumalabas about this. When there are a lot of cases that spread, I mean, the international community has been observing also what is happening in China. There are disease control prevention here in Korea and other infectious disease centers in different parts of the world which are already alarmed about this one and alerted everyone. But first, wala pa rin masyado because in China, they are trying to, hindi pa laki yung issue, parang gano'n. If we talk about the response of China, compared to other countries, of course, knowing the system of government of China, China has an autocratic crisis management system compared to other like democratic countries. Of course, what the government or the Communist Party say, ito lang susundin, no questions asked. Before the Lunar New Year, like few hours before the shutdown or lockdown of the whole Wuhan, they told everyone that there would be lockdown in the Wuhan because of the virus spreading, but it was declared few hours. The intention is para wala masyadong lumabas. I mean, unlike in the Philippines, several days before the lockdown, it was announced, but in Wuhan, it's few hours. But the thing is, again, people have been going out of their hometown days before or weeks because it's Lunar New Year. Also, people from other countries are going back to China, and some are actually going out of China as well. So from that, the virus already started spreading. Hindi rin siya na-control. So again, the measures in China, of course, January 23, I think, first step for quarantine in Wuhan is an extensive lockdown. Flights, trains suspended, operations, roads are blocked. They closed the seafood market, other markets that are selling like exotic foods or like animals, mga ganon. Sinarado din nila. So it's a severe crackdown on this kind of markets like seafoods and other kind of animals that they're saying. Because in mainland China, they say like anything that moves is actually edible. So the speculations of everyone is this actually what the cause of this virus, unknown virus. So community-wide measures against the virus. There's a wide temperature checking.
Okay, Emil, binanggit ni Ivy kanina, di ba, yung lockdown and all. Sinasabi din niya na yung system of China it's not a democratic country, it's not open about, importante sa kanila, it's not open about data, importante yung image and all. But to be fair to China, it wasn't the central government who concealed the virus. It was the local government of the province of Hubei, di ba? Na sinasabi nila that these are just ordinary flu. But in fact, may doctors, yun nga, binabanggit ni Ivy kanina, there are doctors who were actually sounding the alarm na this is a different kind of a pneumonia-like virus. We have to contain this. Even that doctor actually died of the coronavirus disease. My question is, yung lockdown ba na binabanggit ni Ivy na parang kagaya din ng ginawa sa Pilipinas, it was all of a sudden before Lunar New Year, was it too late? And then, if it wasn't too late, did it become too harsh? Na parang 11 million people initially in Wuhan City were quarantined. And then eventually the whole Hubei province, about 70 million people were quarantined. And then maybe give us an idea, why is quarantine the first reaction of government pagka may mga ganitong klase ng disease? Emil?
Since before this pandemic happens, the world doesn't really know anything about lockdown, about quarantine measures. In fact, Wuhan was the first image of the lockdown that the people everywhere witnessed. And we were actually startled by the fact that a city was locked down because of this pandemic. At first, there was a disbelief that something with a magnitude like this can happen to a progressive city like Wuhan. But eventually, the first impression was that the Chinese government was not in control of Wuhan. That's why they had to impose this kind of lockdown. But eventually, as other countries also shut down their borders and their localities, we learned that actually lockdown and quarantine have a history in terms of epidemiological management. To be fair, quarantine has a history since Middle Ages, since the Black Plagues, even during the Spanish flu that happened during the 1920s. It was really quarantine measure coupled with social distancing, which are the textbook solution against pandemic outbreaks like this. Because to be fair, during those times, during those Middle Ages, they do not have vaccine technologies. That's why they really had to resort to this kind of drastic measures to contain a pandemic outbreak. Is it effective? Well, if we are going to believe the data from China, I mean, the number of deaths and the number of infected cases in Wuhan are comparatively smaller than the United States, even in Italy.
That's assuming we believe the data given by the Chinese government. Di ba? Kasi right now, parang 80,000 cases lang ang dinideclare nila, and then the deaths are about 4,000 people, which some people contend that it's not true, di ba? Well, yun lang, para i-contextualize natin yung quarantine. Quarantine means quarantine, di ba? Yung binabanggit mo nga, yung bubonic plague and the Black Death, na-realize ng mga Europeo na nagpapakalat nito mga barko. Dahil pumapasok dun yung mga daga, At pag pumunta sa isang port, lumalabas yung daga, kumakalat yung disease. So what they did was to make sure para walang sakit na kakalat, bago dumaong yung mga barko sa mga port of entry sa Europe, 40 days kayong nasa laot, tsaka pa lang kayo papasukin. Kaya quarantine. There are debates initially, kasi kung babalikan natin yung nangyari sa Pilipinas, people as early as January are asking, we'll not discuss the Philippines yet, but the concept of quarantine. As early as January are saying, yung quarantine kasi dalawa yan eh. Ka-quarantine yung may sakit, tsaka ika-quarantine mo yung walang sakit. Ibig sabihin, hindi ka magpapapasok. Di ba? Sinasabi na natin noon, wala na munang international flights coming from China or the territories of China going to the Philippines. And then the WHO are saying, pagka nag-quarantine ka na ganyan, hindi ka nagpapasok, magtatakasan lang daw lalo yung mga tao. Maybe IB you could butt in pagkatapos ni Emil. Ganun ba yung nangyari? Yung mga, although naka-lockdown ba ang Wuhan, naglalabasan pa rin sila? Emil, yung ganung debate.
I just would like to add first on the quarantine. In fact, actually, during the cholera outbreak during the Spanish colonial period, the Philippine government during those times actually also imposed quarantine to contain some cholera outbreak. Even in the case of Spanish flu, when it hit the Philippines, the Philippine government during those times also imposed quarantine. Now, on the question of what happened to Philippines around January,
wag mo nang Pilipinas. Yung question lang whether a quarantine is actually effective. Kasi initially, the WHO were against quarantine. Of course, it cannot impose on sovereign countries. Kanya-kanya yan. Pero yung sinasabi nila na i-close nyo yung mga borders nyo, they were saying itinatakot lang yung mga tao and all.
Yes.
It's alarmist. So, dwell on that.
Well, just like what I said, diba? Quarantine, social distancing, these are the textbook methods in epidemiological management. In fact, quarantine is always an option for epidemiologists. This is just my personal take. It's just that for epidemiologists, it appears that it is their last choice. Meaning to say, these epidemiologists, as much as possible, they do not want to impose that kind of solution. As much as possible, if they want to contain it, they will do it, they will contain it without doing quarantine measure. And it's just that what happened to Wuhan and even what happened here in the Philippines, it appears that because of the cost of quarantine, our epidemiologists and even our government accepted the fact that we needed to go to quarantine as a last-ditch effort to contain the viral outbreak.
I'll go back to IB. So, yung nakikita natin sa mga news, like people are actually parang nakakulong sa kanilang mga condominiums, nagkakantahan, di ba? We're talking here of Wuhan, China. And then people are delivering food into the people, wala talaga lumalabas. It's like ghost town. From an industrial city, all of a sudden, walang tao sa kalsada and all. Was the quarantine that airtight na wala talagang nakalabas sa Hubei and Wuhan?
Like what I said earlier, before the lockdown, people are going out already because it's Lunar New Year. Wuhan is like an industrial, commercial city. So, many of them are migrants as well. So, definitely, nakalabas. Kasi days before, people are going out already and going home because it's Lunar New Year. But then again, the point earlier being said that the quarantine or lockdown actually caused scare to the people. Yes, definitely. Many Chinese actually want to escape Wuhan. I mean, what Emil said, the fact that it was advised by the epidemiologists to do the quarantine or lockdown, it was not properly communicated. Para saan ba to? It's something new. Bakit may lockdown? It's not properly communicated, no info dissemination, especially, again, the autocratic crisis management in China. Okay, do this, lockdown, quarantine, I mean, what's happening? And they declared it like few hours before the lockdown, they shut down the city. And even here in Korea, it was here, the rumors of lockdown.
Yeah, we'll go to Korea later on. Jeff, I'll go to you kasi the first epicenter was China, di ba? And then all of a sudden, Italy became the epicenter of the epidemic. Well, technically, the South Europe. Ang sinasabi natin dito, when we were talking of quarantine, China quarantined a certain city, pero the flights are still ongoing. Yung mga flights palabas ng China, di ba? So, parang yung mga tao, ang iniisip nila, kakalat yung virus parang mula sa Hubei, mauna siguro muna ito makalapit na bansa like South Korea or Hong Kong, Taiwan, and then maybe Southeast Asia, but tumalon eh. Tumalon siya sa Italy. All of a sudden, nag-spike lahat yung cases. Can you tell us why did that happen? Bakit hardly hit ang Italy biglaan?
Yun yung medyo fascinating sa nangyari sa COVID-19. Italy became the epicenter in the world after China. And na-surpass niya actually yung number ng cases ng China mismo. Well, assuming na totoo yung data nila, no? Pero sobrang bilis ng pagkalat ng virus sa Italy, particularly sa northern Italy. Why? You're saying that a lot of factories, no, mga producer ng mga leather goods, ng mga luxury items, are now Chinese-owned. And majority of their employees are from China. And they never imposed early lockdown. So yung flow ng Chinese workers and Chinese tourists, there's a large group of Chinese tourists, not just in Europe, but I think around the world. Hindi pinigilan ng Italian government yung flow na yon ng tourists plus yung flow ng mga Chinese workers. Kaya naging badly hit ang northern Italy, particularly sa Lombardy. So yung mga lugar na yon, naging badly hit sila. And ang mga Europeans, hindi talaga sila...
But do you know, Jeff, kung ang first cases ng COVID are Chinese migrants or the person reported cases? No, we don't have that.
We don't have that info.
Okay. But isa pang tanong doon, yung kultura ba, for example, kasi mamaya when we discuss Southeast Asia, tatanong ko to kay Emil eh. Pero yung kultura ba ng beso, that, alam mo yon, tight, mayakap ang mga Italiano, mahalik, does that also contributed a lot to the spread of the disease?
Maybe yes, no? Kasi may culture sa Europe na una, walang culture ng mask sa Europe. And people, they did not take it seriously nung initially. No? And yung culture din ng mga pub sa Europe, wherein it's an enclosed space, mahilig sa beso-beso, and things like that. And mahilig sa party, mahilig sa outdoor experience ang mga Europeans. No? Kaya sabi nila, it's one way of spreading the disease na ganun kabilis. And people did not believe it will be that bad until it happened. So may cultural difference then. Yeah.
Okay, thank you. Ivy, I'm going to you. Yung Italy and South Korea, halos magkasunuran lang yung paglabas ng mga first cases nila. But in fact, from what I've read, what's interesting about South Korea is when they saw that there was a pandemic, kasi lumabas yung RNA sequencing. December 19, yung doctor that died, the whistleblower that died, there was already an alarm everywhere kahit na hindi pa identified yon as novel coronavirus, di ba? But as early as January, as soon as the Chinese government released the RNA sequencing ng virus, South Korea actually created their own testing kits. And at the same time, already tested people regardless to mga high risk like people coming in from China and all. But aside from that, alam din natin that at some point nag-spike ang cases sa South Korea even though they tried it. Pero why is there such an attitude? Itong mga South Koreans na they were alert already nung malaman pa lamang nila that there is a possibility that there's a new virus na posibleng maging pandemic. Ivy.
Right. Here in Korea, we have the Korea Center for Disease Control and Prevention, KCDC. So they are in charge with monitoring what is happening in the international on such kind of diseases or infectious diseases is spreading. So like what I've said earlier, December pa lang na kumakalat na siya sa China, I mean, they are looking on it na. And then, given the experience of China on MERS, because of the MERS that was spread in Korea during 2015, nag-ready na yung Korea for other infectious diseases that may come in the future. So,
okay, Ivy, wait. Para lang malinaw dun sa mga listeners natin what MERS is. It's Middle East Respiratory Syndrome. It's also a coronavirus, di ba? It's a coronavirus as well. Yung SARS, yung MERS, these are variations of the coronavirus, just like COVID-19. Okay, go ahead.
So Korea experienced that MERS in 2015, and during that time, actually, we have experienced the same difficulty that other countries are experiencing right now. Like the emergency rooms are not enough, hospitals are not enough. There are very lax visitation measures in the hospital. So anyway, to cut it short, I mean, hindi din sila ready during MERS. So but after that MERS in 2015, KCDC, that Korea Center for Disease and Control, made sure if this will happen again in the future, we are actually ready for this one. So when the news started to spread in China, they already started to design strategy. They run drills to prepare for this one. They already have rapid development of diagnostic kits, I mean, like what you have said earlier. And of course, they made a strategy that is unified, well-coordinated, scientifically and medically sound. They have a vast network of public health systems which are well-prepared for this one, and that they prepared already. Like what you said, they run real. So when the first few cases were monitored or lumabas dito sa Korea, they are prepared. They know what to do. They have first three steps is detection, containment, and treatment. And they do it very fast because they run drills already. But again, unlike China, who shut down or locked down Wuhan, here in Korea, they were able to flatten the curve without closing businesses, issuing stay-at-home orders or other stricter measures that other countries did. What I've said earlier, I'm here in Daegu. Daegu is the epicenter of the virus here in Korea.
We'll go back there
Okay.
sa Daegu, bakit siya nag-spike. But thank you for that input, Ivy. Para lang din contextualize yung scare about MERS, because outside of the Middle East Respiratory Syndrome, South Korea was actually the highest case pagkatapos ng mga Middle Eastern countries. So that's why it scared them a lot, and then they prepared for it. So, Emil, we saw two different strategy, di ba? Yung China did the lockdown, then Ivy said, hindi nag-lockdown ang Korea. It's business as usual, but the public health system are in place. Contact tracing, testing, and then isolating these patients. Mamaya, i-discuss pa natin what happened on other countries in East Asia, why they are successful in controlling the outbreak of the pandemic. So, dito sa Southeast Asia, yung isa sa mga unang outbreak was in Singapore. And they were successful, di ba, initially. And then, all of a sudden, biglang nagka-problema. What happened? Bakit all of a sudden bumagsak yung system that are in place with Singapore that are, alam mo yun, parang hybrid to ng China and then South Korea eh. Although it claims to be a democracy, it's a strong-armed democracy. What happened in Singapore, Emil?
Actually, what happened in Singapore, they actually did not call their strategy a lockdown. Parang they have a different word for it. And during the first months, they actually contained it. They actually flattened or bended their epidemic curve. It's just that it spiked again. According to Singapore government, it's really because of the migrant workers. Why it happened to the migrant community? Because we know for a fact that in Singapore, migrants were boarded in a single house, di ba? Para may boarding house systems doon. Tapos, since it is a small country, space is precious, therefore it is as compact as Singapore. It's just that this is especially true in the case of the migrants.
Okay.
In fact, until now, they are saying that the community transmission is still coming from the migrant.
Ivy, I'm going back to you. So, nakita natin yung China and South Korean experience, but you could also look at, for example, Hong Kong, Macau, Taiwan, and even Japan at some point, di ba? The virus was spreading, but these territories and these countries were able to contain it. What was the strategy, basically? Go ahead, Ivy.
Okay, for the case of Taiwan, if Korea was actually gained experience from MERS, Taiwan learned the experience from SARS outbreak. So, same thing with Korea, where they're actually looking on what is happening internationally on infectious diseases spreading. Same case though with Taiwan. I think for everyone's information, Taiwan actually is not member of the World Health Organization. This is because of their situation between China. It's one China policy. So, China is the one that is member of the World Health Organization. So, when the news started to spread that there's kind of disease spreading in China, Taiwan sent some inquiries to World Health Organization asking kung anong nangyayari. Could they give them information about this one or what are the facts about this one? What Taiwan said is that we are just receiving sometimes no response or just noted, okay, we will get back to you, but nothing happened on those requests. So Taiwan's lack of access to World Health Organization data and assistance pushed them to become more aggressive and proactive on preparing kahit wala pang infected cases or first case in Taiwan. So by January, they actually made travel bans for some of the many ports in China. China is still the largest trading partner of Taiwan. So business come and go. There are a lot of flights as well, but because of this news, they banned travel for many ports. They stopped even cruise ships, and they have strict implementation of quarantine measures on the airports. They already made some restrictions for those coming and going to China.
Okay, so it also doesn't hurt that the Vice President of Taiwan is an epidemiologist, di ba? So he understands kung anong nangyayari na to. At the highest level, science took charge because the Vice President was an epidemiologist.
Taiwan is very proud of their world-class healthcare system. And the one who's in charge with the COVID right now is the one who has been in charge with the SARS outbreak before. So they said that they are ready for this, we know what to do.
Okay. Para lang sa context yung SARS and MERS, these are, well, according to epidemiologists, these are coronavirus disease. Pero they are not as contagious as the novel coronavirus that we have right now. Anyway, I'm going to you, Jeff, because nung kumalat sa Italy yung cases and then it spread through Spain, ang dami ding namatay dyan. Pero nakita natin na kumakalat na sa Europe yung virus. But there were, I don't know, several approach, but two approach were clear. Although late na nag-lockdown ang Italy, at nakikita pa rin natin na maraming namamatay, was that the reason why some other countries opted not to do a lockdown? Kasi regardless kung nag-lockdown siya, mataas pa rin ang cases at madami pa rin ang cases ng death. Could you take us to that policy debate on how to deal with this virus in Europe? Jeff?
Dalawa yung school of thoughts eh. Una yung lockdown nga, yung pangalawa yung herd immunity na tinatawag nga. Sinundan ng, I think, UK, and the other one is Sweden. You know.
The Dutch Prime Minister also played on it, on the concept of herd immunity. What's a herd immunity, Jeff?
So, it's a concept na i-expose mo at least a big percentage of the population para makontain mo yung virus, para expose mo sila at makadevelop sila ng immunity to protect the whole of the population. Yung UK, initially, they want to do that. No, nag-lockdown na ang Ireland, pero yung UK, nagde-debate pa rin sila kung kailangan ba nilang mag-lockdown, mag-impose ng strict measures. But later on, based dun sa data projection nila, maraming mamamatay. Around 500,000 na mga UK citizen ang mamamatay if they go for the herd immunity. So, nag-impose na sila ng lockdown later on.
Wait, Jeff. Ang nakakatawa dyan, of course, Boris Johnson played on the idea of herd immunity, di ba? He went to the hospital shaking hands with the COVID patient, and then all of a sudden, siya mismo nag-contract ng COVID-19. And then maybe that was the epiphany of Boris Johnson na hindi simpleng trangkaso to. That ito ay seryosong sakit, hindi ba? Because he was in ICU for a while. And that's scary if you're scary for the country. If you're the head of the government and all of a sudden, tinamaan ka at na-ICU ka. Di ba?
Correct. They said it's a moral issue kasi you will consciously let people die, especially mga older people, mga grandmas and grandpas ng UK. That's why there's a big shift later on nga to impose a lockdown as well. And sa case naman ng Sweden, yung mismong top epidemiologist ng government ang nag-play ng idea na yon. And it turned out na hindi siya naging effective, no? Compared dun sa mga bansang nag-impose ng lockdown, mas marami yung rate ng namatay sa COVID-19 compared dun sa mga nag-impose ng lockdown. Let's say Germany, no? Pero yung Iceland din, yung mga Nordic countries, except nga dito sa Sweden, naging okay din sila somehow dun sa response nila.
Tingnan natin halimbawa, so doon tayo sa herd immunity muna, Jeff. So itong Sweden, itong Dutch, and then UK initially played on the idea of herd immunity. Para lang malinaw yon, hindi naman talagang magpapaparty ka ng COVID party, di ba? Ganun yung idea na parang hahawahan mo lahat. But, gaya ng ginawa sa Korea, hindi nakasarado ang mga businesses, open ang schools, open ang church. So, sinasabi nila, kung magkasakit ka, yan, i-isolate ka lang din, may hospitalization pa rin, hindi nga magla-lockdown. Bakit ba mahirap itong herd immunity? Why is the strategy on herd immunity difficult, Jeff?
Una, based sa science, walang empirical evidence na makaka-reach ka talaga ng immunity dun sa virus. Kasi
because it's a new virus.
Yeah, it's a novel virus. So, yun yung number one, na parang wala nakakaalam if makaka-develop ba talaga yung tao ng antibodies or kung meron talagang immunity dun sa virus. No? Pangalawa, it will take a lot of people, like, if I'm not mistaken, 60 to 80% of the population should be infected for it to be effective. And pag tinignan mo yung percentage ng mga tao na pwedeng mamatay, and that will be hundreds of thousands. So in the case of the UK, ang projection nila, it can kill 500,000 people. So it's also a moral issue more than science issue now. Kasi you are cautiously letting people die, especially the older people. Kaya mahirap ma-reach yung end goal ng
parang sinasabi din ng science, you have to reach about 70% of the population before you can actually say that there's an immunity. Pero yun nga, the big debate about this is a novel coronavirus. We don't know what this is. So, Emil, I'm going to you. Kasi there are two stories in Southeast Asia, hindi ba? Nakita natin ng Philippines, nakita natin ng Indonesia, at some point Malaysia, spiking cases. Pero I'm gonna read these statistics to you. And then tell me, bakit ganito yung statistics na to? Laos, 20 cases, no death. Cambodia, 225 cases, no deaths. Vietnam, 431 cases, no deaths. Myanmar, 350 cases, 6 deaths. And Thailand, ito yung pinakamataas, 3,295 cases but only 58 deaths. Mamaya makikita natin yung statistics sa Pilipinas saka sa Indonesia. Well, Brunei also, pero maliit kasi yung Brunei. Brunei, 141 cases, 3 deaths. So, bakit ganon? Why are there two stories ng Southeast Asia? Itong mga nasa, sabi ko nga sa isang post sa social media, walking distance lang ko sa China. Dahil they're bordering China. Yet, the cases are so low and then halos walang death. Ano ba? World class ba ang kanilang healthcare system? Yun ba yun?
Actually, in terms of economy, in terms of the healthcare system, Vietnam and Philippines are almost the same. It's just that both countries have different experiences when it comes to COVID. I would like to focus on Vietnam. What happened in Vietnam is really about their sense of urgency. They closed their borders days ahead than the Philippines. They also implemented the contact tracing while closing their borders and, of course, social distancing. Then what happened on Thailand is that they also closed their borders. It's just that what I'm looking at Thailand is that the people are actually not as tight-knit. Meaning to say, I'm looking here at the cultural aspect. For instance, the case of the Philippines, we are a connective culture. That is according to Felipe De Leon, a former NCCA chairperson. We communicate through touching. Touching is part of our ethos, of our spirit. And perhaps that is one of the reasons why we have a spike of cases in the Philippines. Although, of course, it also has something to do with our government. But unlike for instance, in Thailand, the way they greet, they do not handshake, right? In Thailand, they just bow their heads, as well as other Buddhist countries like Cambodia, Myanmar. They are bowing their heads. Laos, diba? It's because of their Buddhist tradition. So, although culture is just one part of the reasons behind here.
For example, it's impolite if you touch their heads sa mga tao na to.
But another reason that I am looking at here is that because these countries in the mainland Asia, in the peninsular Asia, perhaps in terms of networking of their experts, of their epidemiologists, there is already a network and an infrastructures wherein their experts are already communicating. Diba? Since magkakatabi lang naman sila mga bansa, and they also share technologies and insights and intelligence. So actually, this is a puzzle, but I think those are some probable reasons behind diversity of experiences in terms of handling COVID in Southeast Asia.
Do you think nakatulong din yung types of government? For Vietnam, for example, they're a communist country as well. Tingin mo ba merong effect yon sa type of response na meron sila compared sa Pilipinas?
Well, Vietnam is communist as well as China, but the model of China is not really the one employed in Vietnam. The one employed in Vietnam is a less severe lockdown, di ba? It's just that they were just focusing on contact tracing and testing. So, in terms of government, yes, perhaps it has some impact, especially in the case of China versus Korea and Taiwan. But in the case of Southeast Asia, I'm not really sure if government is a significant factor in terms of the results of their strategies in handling this pandemic. But as what I said, Southeast Asia is a puzzle. We cannot really know, at least today.
Sabi nga natin, we're only diagnosing kung ano yung at the moment. Anyway, I'm going to IB. Somehow, tinouch ni Emil yung cultural aspect na maybe help itong mga bansa sa Southeast Asia, yung mga Buddhist countries in Southeast Asia to contain the pandemic. But here in America, there's a raging debate about masks. A certain segment says na they don't want to use it, it's an infringement of liberties. A certain segment says, kailangan natin to. We're not gonna discuss the US case now because that's for a separate podcast. But IB, how is mask taken as a precautionary measure to combat the pandemic in East Asia?
If in Northeast Asia, okay, let's go first to Korea. If you ask the head of the public, the KCDC actually here, they are always proud of that Korea has a face mask culture, wearing mask culture, as well as Japan is also saying the same thing. China is also saying the same thing. So when there's a need to wear face mask, it's very easy for all the people to follow to wear face mask. Because hindi naman siya bago. They have been wearing masks. It becomes a fashion as well. They have been wearing masks because of yellow dust. For example, here in Korea, we are actually receiving alerts that there's a pollution level like this one, the air is bad. But you could actually see, clear naman, you can breathe normal, pero people will wear masks because the government sent a text message that the air pollution is high. So what more when this pandemic came, that this is actually might be spreading through air or madali silang pasunurin. So again, like what I said, the public health officials are actually proud of with this kind of culture that they have, like face mask culture and hand sanitizing culture. So hindi na rin siya problema. It's the same case with Japan and Taiwan and China, that they have this culture already of wearing face masks. If may ubo ka or sipon, they wear face mask. This is a fashion. You can buy it anywhere.
Pero ito yung tanong ko, when the COVID, ang ginagamit lang ba is that the usual cloth mask? Kasi I have a friend in Hong Kong that when this was initially happening, early January, he was asking me kung meron ba dito yung mga surgical mask because nagkakaubusan daw sa Hong Kong. Was that also the case no COVID? It's not just cloth mask but yung mga surgical mask ang ginagamit?
Actually, if for dust mask here, yellow dust mask here in Korea, the KF94, what you call it, KF95 in other countries, yun na talaga yung ginagamit namin actually, not the surgical mask. But prescribed by the hospitals, they said that mas mura yung surgical mask than the KF94 that the Koreans are using every day for the yellow dust. So when they said that the public health official said that okay lang yung surgical mask and it's actually accessible to all pharmacies here, you could buy it cheaply before and during the height of the pandemic. Medyo nagkaubusan din, but the thing is, it's available. Hindi siya mahirap hanapin. And even the surgical mask, which is cheaper and lighter, is people could easily buy it because they have been buying actually much expensive masks for every day.
Okay, para lang malinaw tayo doon, no? Of course, we understand kung limited yung supply ng mga surgical masks and itong mga medical masks, kaya pinagbabawal ng gobyerno ito yung gamitin kasi syempre dapat unahin natin yung ipaggamit ito sa mga frontliners kung limited yung supply. But kung kagaya nga ng Korea, they didn't have a problem with the supply of this kind of mask, somehow it helped them better prepare for it. IB, you want to say something?
Actually, for example, in the case of Taiwan, they started banning the export of masks in Taiwan para magagamit lang siya ng locals. Here in Korea, when the rumors spreading about the virus, people are actually buying masks and sending out to their countries. I actually even brought some masks here to the Philippines. The production of masks right now is okay, but during the height of pandemic, especially here in Daegu City, which is the epicenter, kakulangan din naman talaga ng mask. There's a days only that foreigners, especially, or even the locals, could buy masks. Depende yan sa ID mo kung kailan ka pwedeng bumili sa pharmacy. They try to control it also. Unlike before, pwede kami bumili ng kahit ilang gusto namin. But during the height of the pandemic, you can only buy 2 sa isang bilihan and you can only buy thrice a week. But the good thing is there are a lot of people who volunteers to give free masks to everyone. There are different NGOs, churches who are actually volunteering and provide.
Thank you, IB. Ginawa din, yung sa Taiwan, ginawa din sa China yun eh. They nationalized the production of masks and PPEs. Kaya nagka-problema din yung America about it because yung mga supposedly American companies, they cannot export. Lahat ginamit locally. I'm going to you, Jeff. Kasi nakita natin, di ba? Italy, Spain, they were badly hit. Ito yung mga tourist area. But Greece, which is also quite touristy, hindi tinamaan ng husto ng COVID. That's my first question. And then, let us know, anong ginawa ng Iceland, anong ginawa ng Germany, that somehow mas naging effective to kumpara sa level ng healthcare system ng other European countries. Let's start with Greece. Go ahead, Jeff.
So, sa case ng Greece, no, kasi tourist country ang Greece, no, so nakipagtulungan yung government sa tourism industry to conduct yung stringent measures to contain the virus. So, andun yung strategy ng testing, isolation, contact tracing, at saka treatment. And naging effective yon precisely because nakapag-cooperate yung public at sa help nga din ng tourism industries like going to a certain location, checking your temperature, doing sanitation, impose ng social distancing. Kaya less yung cases nila sa Greece, surprisingly.
Yeah, and they acted early on. Unlike Italy na medyo nagdili-dali pa, hindi ba?
Correct. So sa case ng Germany, ganun din. Since malaking country sila, at malapit din sila sa Italy, on a bigger scale din yung testing nila, yung isolation, contact tracing, and treatment na sinuport natin ng public at may political will din, no? They use a lot of public funds to fund yung effort nila to contain the virus. And sa case ng Iceland, they did the same thing. And nakatulong din na sobrang liit ng population nila. So,
na madaling i-contact trace, madaling... Yeah, correct. Mm-hmm.
Kaya less yung cases nila.
Cases ng deaths and cases nila. So, it was easily contained. So, okay. Let's go to our last case. Siyempre, Pilipinas, Emil. So, ito medyo contentious at baka ipatawag tayo ng NBA pagkatapos nito. So, Emil, tell us, what was the approach? Was the approach effective? Ano yung pwedeng baguhin? Ano yung pwedeng improve? Go ahead, let us know, Emil.
Of course, this is just
At wag mong sasagutin sa amin that this is a puzzle, ha? Nasagot mo kanina that this is a puzzle in Southeast Asia. So tell us.
Well, at least this is just my personal perspective. It appears that the strategy of the Duterte government is to follow the textbook approach in handling the pandemic, that is ECQ plus social distancing. Although at first, during the first week of the outbreak, Representative Salceda in Bicol was already calling for a 7-day lockdown. And during those times, it was unthinkable for us. Parang no one was really taking him seriously because we were not epidemiologists, and these talks about lockdown, quarantines were not really known to us during those times. That's why we thought that the proposal of Representative Salceda was a bit ridiculous. But it turned out that it was the textbook approach in handling a pandemic. For me, I think the epidemiologists in the government followed that. And since they already implemented the lockdown, they were also, at least for me, as the way I see is that since there is already an ECQ, then there's no more impetus for them to conduct mass testing. Because that was the logic of some Filipino epidemiologists. Since there's already an ECQ, then we can stick with a conservative testing protocol. Although, during those times, the talks about mass testing were already gaining momentum. That's why, eventually, the Philippine government succumbed to the public pressure of mass testing. Although it's still contentious up to this day, still, there was an effort from the government because of public pressure to speed up and to increase the testing that is happening in the Philippines by modifying its testing protocols. Now, it is effective? Of course not. It's not effective the way I see it, because perhaps it is effective during the ECQ time. Because during the ECQ time, I say that it's effective because of the indicator that our healthcare system was not overwhelmed. That's just my simple logic. Since our healthcare system then during ECQ was not overwhelmed, perhaps it was effective. But right now, that talks, especially on the ground, that hospitals are being overwhelmed, that is already a reliable indicator that there is a spike in cases. There's already an increase in cases in the Philippines. That's why our healthcare system is starting to get overwhelmed. Given this kind of situation, I can say that it's not effective after they lifted the lockdown without mass testing or expanded testing and contact tracing, strong contact tracing strategy. When they lifted the lockdown, basically, our situation started from zero again.
So, Ivy, I'm going to you. Kasi yung China model, ginamit ng Duterte administration in middle of March, yung extreme lockdown. And in fact, ang Pilipinas may pinakamahabang lockdown sa buong mundo, hindi ba? But we now see that China has contained the virus. Mga konting community transmission, pero paputok-putok lang, hindi na umakyat ulit to that level that we saw early January. But sa Pilipinas, kung maalala mo, early July nag-lift tayo, hindi ba? Itong si spokesperson Harry Roque, nagsasasayaw because he said, we won. Natalo daw natin ng UP prediction na aabot ng 40,000 yung kaso. A month after, right now, we already have 80,000 cases. In short, nagdoble. So, anong pinagkaiba? We had the lockdown in the Philippines. China had the lockdown. China contained it. Tayo mukhang hindi naman na-contain. What happened, IB? What do you think was the difference?
Nauna kasi yung lockdown ng Pilipinas. For other countries, okay, let's start with China. Nauna kasi yung detection. Saan ba nagsimula? Saan yung epicenter? So, when they detected that it started in Wuhan specifically, so the containment, the lockdown only in Wuhan, and they started, okay, they detected the virus that in Wuhan, they made a lockdown. Lockdown is only one of the measures, but they have the detection, meaning they need to trace kung saan nagsimula, who are the people infected. Contact tracing is so good because they're using digital infrastructures in order to do contact tracing. Hindi siya just shooting anyone na kung sinong gustong magpa-test or kung sinong inuubo or sinisipon. Hindi ganun yung type ng mass testing, hindi ganun yung contact tracing. Again, lockdown is one of the measures, but it's not enough. There should be rigorous and very effective detection, meaning contact tracing with the use of digital infrastructures, the use of different apps. For the one that like Alipay and for payment purposes, they have used it to credit cards, they use it to contact and to trace people kung sino ba yung mga nahawaan. Pag if there's someone who is detected to have a virus, they will check saan nila ginamit yung mga credit cards. So from that, they will see ito yung mga people that they have communications with. So they will start quarantining these people, they start testing these people. Mass testing again, like I think Philippines also know it, that it does not mean that you will test everyone. But it is those who are closely contacted with an infected person, they will do it. So again, detection first, containment, and the next one would be treatment. So, ganun yung sequence. How did China handle it as well as other Northeast Asian countries? I think for Philippines, it's the lockdown. Asan yung epicenter? Sa Quezon City ba yan? Sa Manila ba yan? Sino yung nagsimulang tao? Sino yung mga... Wala na kasing ganun.
Jeff, dalawa tong ibabato ko sa'yo. Una, yung sasabihin to ng ilan, na kaya hindi naging effective ang lockdown, although ito yung pinaka-stringent na lockdown. To contextualize, halimbawa, yung sa ibang bansa, yung mga lockdowns, walang checkpoints eh. Sasarado lang yung mga business establishments, so wala ka pupuntahan, di ba? Hindi ka makakapanood ng sine, hindi ka makakapagsimba and all. Pero sa atin talagang totally sarado, walang transportation and all. Ang sasabihin ng iba, kaya nag-spike ang cases, matigas kasi ang ulo ng mga Pilipino. So yun yung gusto kong una mong sagutin. Pangalawa, nung ginawa yung lockdown, sinasabi ni Emil that we somehow contained it dahil hindi na overwhelmed ang ating hospitals, ang healthcare system. Was it really the case? O baka naman dahil wala na nakakalabas, wala talaga makakapunta sa ospital? Jack.
Two questions. No? Una, pasaway ba talaga yung mga Pilipino? And pangalawa, totoo ba na naging effective siya dahil hindi na overwhelm yung hospitals natin during the ECQ? Number one, kung maalala natin, ang unang case ng COVID sa Pilipinas ay Chinese. And ang unang Filipino na na-detect natin na infected ay galing ng Japan. Yung mga sumunod na mga cases are from affluent places. So ito yung mga taong nagka-travel. Hindi siya dahil sa matigas yung ulo ng mga Pilipino. Another thing na pwede nating masabi na hindi pasaway yung mga Pilipino, merong recent study na nilabas ng isang UK think tank na nagsasabi na Pilipino yung pinaka-obedient sa pagsusuot ng mga mask sa buong Asia. The whole world. So, doon pa lang, makikita mo na yung narrative na pasaway yung mga Pilipino, medyo contentious siya, no? Totoo ba yun? Yung sa point naman ng hindi overwhelmed yung...
Hindi. Para lang may context yung tanong natin kung pasaway ba yung mga Pilipino. Pag sinabi kasing pasaway yung mga Pilipino, ang pinatatamaan talaga dyan yung masa eh. Kaya binanggit mo yung mga affluent. Hindi ito tungkol sa Pilipino in general, kahit anong social class. Nung sinabing pasaway ang Pilipino, sinasabi nila na pasaway yung mahihirap, yung jolos, yung masa. kasi sila yung naglalabas daw. Pero kagaya nga ng binanggit mo, some of the first cases sa Pilipinas, yung mga nagbiyahe abroad.
Correct.
Diba? Go ahead, Jack.
Sa case naman na hindi overwhelmed yung mga hospitals ng Pilipinas, may cultural din, no? Kasi mga Pilipino talaga hindi mahilig magpa-hospital. Kapag may naramdaman ka na akala mo sipon lang o bulang, iinuman mo lang ng salabat or ng kalamansi. Bio-flu. So, ganun yung culture natin. And karamihan din ng mga Pilipino talaga, mahal kasi magpa-hospital sa Pilipinas. Kaya hindi natin first instinct talaga na pumunta ng hospital kapag kami nararamdaman tayo. So maybe that's one, no, na hindi mo kasi din ma-distinguish yung symptoms siguro ng COVID sa mismong normal na flu or normal na sipon, ubo. One way siguro pat hindi overwhelmed yung hospitals natin before. And particularly because hindi nga pasaway yung mga Pilipino kasi hindi nga tayo lumalabas Kaya hindi siya na-overwhelmed that time. And nag-spike siya nung nagsimula na tayo mag-open ng economy ulit. Hindi yun dahil sa pasaway yung mga Pilipino. Kaya sila lumalabas kasi kailangan ulit nilang magtrabaho. They have to choose between getting infected or dying out of hunger.
Somehow, I think, pag-uusapan natin to in informal discussion, sinasabi nga ni Emil, yung mga kaso sa Antipolo, these are people commuting to Metro Manila from the provinces. And somehow, feeling ko, when you opened up the economy, binuksan mo uli yung mga negosyo, tapos yung transport level mo, dahil lang sinasabi mo, mas magkakahawahan pag nagsiksikan sa jeep. Pero, mas magkakahawahan kayo dahil sabay-sabay kayo naghihintayan. Yung pre-COVID transport mo, grabe na nga yung limitation, mas lalo pa dahil tinanggal mo ang jeep, tinanggal mo yung ibang transportation, pero binuksan mo yung economy. So ano itong gagawin ng mga tao, hindi ba?
Pinabalik pa sa trabaho yung mga tao, pero hindi mo sila binigyan ng transportation. So, walang sense, di ba? Kasi at the end of the day, kailangan mo pa rin sumakay, kailangan mo pa rin ng transportation. And dahil limited yung transportation, lalo nagsiksikan yung mga tao. Diba? Nagkaroon ng mahabang pila, pag merong available, siksikan din sila. So, how can you do social distancing kung percentage ng transportation ay limited sa, let's say, less than 50% ng original capacity niya? Na-defeat yung purpose.
Thank you, Jeff. So, Emil, give me biggest hit na ginawa ng Duterte administration in combating the pandemic and the biggest miss ng Duterte administration, the hit and miss of the Philippine response to COVID-19.
Well, to be fair, the biggest hit is that, of course, the Philippines is one of the first ones who imposed a lockdown, even in the world. Although, of course, it was actually also the Philippines who reported the first death due to COVID outside of China. Although I still believe that the ECQ actually prevented the worst case scenario. Because during March, the worst case scenario is for us to become another Wuhan and in Italy. And I think we prevented that worst case scenario when the Philippine government implemented the ECQ. It's just that without contact tracing and without expanded testing and without ramping up our healthcare system, which I think are the biggest misses, especially I'm looking here at the contact tracing. I think that is the biggest miss of the Philippine government because there is no digital infrastructure, there is no physical manpowers like what happened in Japan. Sa dalawang front na yon, digital and manpowers, sobrang kulang na. That's why the Philippine government did not really conduct effective contact tracing strategy dito sa case natin. So, yun yung answer ko. Number one is
just to back in lang doon sa digital side, no? In fairness sa government, they reach out to the private sector to do some technology intervention. No? And I'm part of that volunteer group from the private sector who tried to help them. Pero nagkaroon din ng problema sa management and sinabi nga ng dating USEC ni Eliseo from the ICT na pati yun pinasok ng politika, no? Kung anong contact tracing yung gagamitin. At halo-halo, labo-labo yung mga technology na ginamit, no? Walang coherent plan, walang unified plan yung government to use it. Kaya hindi rin siya naging ganun ka-effective. They tried to, pero yun nga, they again failed.
Yes. I think, Jeff, add ko lang, and even you pointed out that the Philippine government tried to tap on that digital infrastructure. Hindi kasi naka-laid down yun eh. It was not laid down in the community. Maybe the Philippine government initiated about it. Eh, sino naman yung iti-trace nila with digital infrastructures? People are not using credit card. People are not using apps. Even they put that initiative, how could they actually implement it on the root of the problem or the main solution is to do contact tracing? People are not...
Correct.
Well, I agree with you.
Wait lang. Yung sinasabi, well, Jeff, to be frank about it, the app that was designed was not actually to combat COVID
Yeah.
Para tuloy-tuloy yung flow ng transportation ng goods, hindi ba?
Well, there's a
Yun yung isa,
contact tracing app. Yeah.
Yun yung isa, yun yung una yung ginawa
Yun yung
Kasi
unang ginawa.
nakita nilang problema out of the lockdown was itong mga truck hindi makapasok sa mga lugar kasi kanya-kanyang barangay may lockdown So
Correct.
that's why you designed that app. That's not the problem. Di ba? Hindi naman yung palagay ng problema. Ang problema natin yung sakit Wait dyan. Okay? So, babalikan ko lang si Emil doon sa kanyang hit and miss yung sa ECQ and all. I mean, hindi ko mag-gets talaga I mean, ikaw din hindi mo maintindihan. Pero you look talaga at East Asia, from Japan to Indonesia, pag tinignan mo yung mga cases, it's China, it's the Philippines, it's Indonesia, and all the rest ng kapitbahay natin were able to contain it. Anong meron? Di ba? Sa akin ang tingin ko, this government, the Duterte government, has no respect for the virus. Kasi initially, kung maalala mo, sinasabi ni President Duterte, 2 kaso lang yan. Parang si President Trump, ganun din ang sinabi, di ba? 2 kaso lang yan, mawawala yan ng pusa. As early February, Dr. Salbanya, part of the ATTY team, was saying, magpasalamat kayo sa amin kasi na-contain namin tong virus na to. That was in February. He was tweeting about it, pinagyayabang nila na contain nila tong virus na to. And then March 15, all of a sudden nag-lockdown tayo without a coherent plan. Siguro na, feeling mo nga nawala yung transmission kasi wala nakakalabas Pero ito nga, from a month ago, like 40,000, now, the double in a month's time, baka nga umabot tayo ng 1 million before the end of the year. Before a vaccine could be. So, ito, para sa lahat, before we end this podcast, lessons we could all learn from the pandemic. If you want to respond, Emil, siguro huli kita. Jeff, lessons we could all learn from this pandemic.
So, for me, number 1, science over politics. Kailangan matuto yung mga leader natin. Pag merong mga ganitong klase ng problema, you should stick to science and not to politics. Makita mo din yung overall mindset. Kapag nakabase ka sa siyensya, alam mo kung ano yung gagawin because this is not something that you can resolve by just your mere opinions. Yung mindset ng militaristic approach, yung mindset ng pseudoscience, yung mga tuob na yan, hindi yan nakatulong sa overall strategy ng gobyerno at hindi siya nakapagdala ng confidence sa mga Pilipino na labanan yung COVID-19. And number 2, leadership. Wala akong nakita na push ng leadership to, again, inspire the people on how to prevent all of these things in the first place. Walang malinaw na plano, walang malinaw na mensahe. Mapansin mo, iba-iba yung sinasabi ng mga government officials, lalo nakalito. Number 3, siguro yung sense of din ng mga tao, Hindi tayo masumingi ng sa gobyerno. We let it happen. Hindi naging ganun kalakas yung clamor ng tao for the government to do their jobs. So, yun yung opinion ko about
yung take mo, lessons from this pandemic. Okay, Ivy?
Maybe I would add on, in addition with that, is what are the lessons that we could actually learn from Northeast Asia, Korea, Taiwan, especially, and of course, of China on this one. First is that, of course, we should learn already from this COVID. China, Japan, Taiwan, they learned from MERS, they learned from SARS. They did something for their public health system. They have a vast network of public systems that are really effective. They have good healthcare systems. Digital health infrastructures are actually laid down already. There's a good collaboration between the government and the scientific community. And this is unique for South Korea, Taiwan, and Japan. There's really a trust in the government, transparency on all the information on what is happening, gain the trust of the people. So whatever measures are actually being laid down, they have trust on what the government is doing. So I think these are the things that Philippines should actually, and other countries who's actually had difficulties on this time of COVID, should take a look into. I mean, for the SONA of the president earlier, he wants to have like a sort of the disease control prevention center of some other countries. Medyo reactive, but this should be done in the future, and we should really put a lot of budget on this healthcare system.
Okay. Thank you, Ivy. Emil?
Although yung mga sinabi nila Ate Ivy, Kuya Jeff, very comprehensive. I mean, si Kuya Jeff talked about politics, the political aspect of this pandemic. Then, Ate Ivy talked about international relations, lessons learned from other countries. Now, I would like to focus here on culture. For me, this is a failure of culture. Number one is our propensity, the Filipino propensity to self-sabotage. Then secondly, failure to utilize our cultural values in order to mobilize people to fight the pandemic as a community. I'm looking here at the values of bayanihan. I'm looking here at the values of pagtutulungan, which I felt were not really utilized by the government. And I felt this is also because of the failure of the government, of the current leadership, in terms of communicating, di ba? It's a failure of communication, it's a failure of inspired leadership. Our government failed to mobilize people to use our inner strength. Because actually, the way I see is that those countries who are successful or which are successful in handling the pandemic, they use their comparative advantage. They have different advantages that they use. For instance, Japan, although they are really digitally backward, but still their advantage in terms of their solid manpowers, healthcare manpowers, they use that to perform an effective contact tracing strategy. In South Korea and Taiwan, they use technology, they leverage technology. But here in the Philippines, it appears that we don't have any comparative advantage. We are not using the comparative advantage that we could have culled or that we could have gained from our culture. And that comparative advantage is our culture of bayanihan, pagtutulungan, pagmamalasakitan, which unfortunately the government failed to mobilize and inspire.
Okay, thank you, Emil. Salamat sa mga input nyo. Well, this is just the pandemic, hindi ba? If we would imagine a future, for example, solar flares or an asteroid hitting the Earth, or an alien invasion, of course, that's far-fetched. Imagine kung anong response ang pwede natin gawin. So, at this point, we will be joined by 5-term congressman of the city of Muntinlupa, and he was also the author of the Public Health Emergency Council Bill, which seeks to establish a preparedness system for public health emergencies such as pandemic. Good morning, Congressman Rufy Biazon. Thank you, Congressman Biazon, for joining us. COVID-19 showed us how the world is unprepared for a pandemic. How do we prepare for the next pandemic, the big one, or a calamity of extinction proportion like an asteroid hitting the Earth?
Well, I think the country is prepared for calamities such as the big one, the big earthquake, because over the years, since the passage of the DRRM law, of which I was one of the authors, the country has been able to set up the organization, the structure, processes, procedures, and the training drills that are being done. Probably we would just need to add to the equipment that we have in order for us to be truly 100% capable and prepared for the big one. With regard to a pandemic, which turns out to be the biggest threat that a country will face, greater than the big one and even greater than terrorism itself, we should be really beefing up our health services. Because as we've seen from 2003, when SARS broke out, we were just spared, but it was a preview. That's why after SARS, I had filed a bill to set up the Public Health Emergency Council, which would prepare for a pandemic. Unfortunately, that was 2003, and 2020, we actually got hit by this pandemic. We were not really that prepared. So with this experience, we should take a look at a pandemic as the greatest threat to us, perhaps even greater than the big one, because the big one is just short-lived. Once the earthquake happens, we can respond and then immediately go back to normal living and just build up the infrastructures. But in a pandemic, such as what we're experiencing, there is uncertainty as to when it will stop. Our only way out is a vaccine or a cure, or if the virus dies out. And then even the response is difficult. As an experience, we cannot just simply go out and give relief to our people, because we are also concerned about our responders getting hit by the virus through transmission of person to person. So it's such a difficult thing to handle, and that therefore it should be a learning experience. We really first have to build up our health institution, health delivery system, to be able to manage and handle a pandemic, set up our response system with adequate stockpile of, for example, in this case, PPEs. So in our preparation for future disasters, our current experience should really be a learning experience. We should not just rely on getting through this particular pandemic, but we should really be using this as a means to learn to prepare for the next. Because eventually there will be another pandemic. Just like the big one, there is a certainty to that. It might be a more virulent strain of a virus. So we should really take this seriously, and perhaps it would even be necessary for us to have a paradigm shift with regard to how we put a priority on health services for the people. We believe that this is an opportunity, that the one we are experiencing now, for us to prepare for the future, because that's the only thing we can do with it. Prepare if disaster strikes. We'll be able to respond quickly.
Okay, sir. Thank you very much. Thank you for joining us in the Naked Politics Podcast. Thank you very much, everyone. This is the Naked Politics Podcast. Don't forget to subscribe to our YouTube channel. Look for our social media accounts on Facebook, on Twitter, and on Reddit. Look for the Naked Politics Podcast.